Welcome to the new year, where it's time to make resolutions. In this video, I give you 7 resolutions to consider if you're raising a child with a special healthcare need. Let's get started. Number 1, IEPs. In the new year, I want you to understand what this document is, what it does, and what it does not do. In the coming months, you'll have an IEP revision meeting where you get to sit around a table with educators and paraeducators and individuals who are invested in the progress of your child to look at the progress that your child is making and determine if they're on track. Are there things they're doing at school that are not working? Are there things that they're doing at school that you would like to see done differently? This is your opportunity to express those concerns, but in order to be heard and have that conversation be meaningful and effective, you have to understand what an IEP is. In previous videos, which I'll link above, I talk about an IEP versus a 504 and some of the differences and what these documents do. I'd encourage you to go watch that, but please get ready in the new year to discuss your child's IEP. Not only is it important for you to understand what this document is, it's also important for you to understand what this document is not. It's not a replica of your home routine. School cannot respond to behaviors in the same way that you can at home. While your strategies at home may be very effective, and it's important to discuss those effective strategies with the school, please understand that they're not bound to do at school what works at home, but they can certainly benefit from that insight. Resolution number 1, understand your child's IEP. Number 2, treatment strategies. In the new year, it's a fantastic time to look at, do we need to be a member of a health club? Do we need to stop being a member of a health club? What do we start? What do we stop? The same is true for therapies. Listen, I love your therapists. They are awesome. Your speech therapist, your occupational therapist, your physical therapist, all the therapists. But please understand that it's okay to interrogate those services and ask a few simple questions in the new year. Is your child making meaningful progress? You can be in therapy for a very long time and make incremental gains, but there are seasons where your child will plateau. Maybe in this plateau, it's time to think about discontinuing the service or taking a therapeutic break. Maybe it's time to think about accessing a different therapy provider in the same group or looking for another group. It's not bad and it's not wrong if you're going to spend all this time and energy going to therapy sessions. Please make sure that your child is making progress. Another aspect of therapies I want you to consider is timing. Are you going to multiple different therapy sessions a week at the same facility? So you're going to speech on Monday, you're going to OT on Thursday, you're going to PT on Wednesday. Is it possible for them to stack all the therapies together, particularly if your commute to these therapies is extended? I've seen lots of families over the years that are traveling 60 or 90 minutes one way to get speech, and then they go back. And then 2 days later, they go down for PT and OT. What I want you to discuss with your therapy group is the possibility of stacking these services on top of each other in order to optimize the time that you spend. If you go to Costco, you don't just go to buy milk and then leave, and then go back the next day and buy that really good popcorn. You want to get it all done at the same time. Your therapy group might not be able to do this. You might need to take a break until slots open up to stack on top. Maybe that's okay. And you can't decide this unless you stop and think about it. So make the resolution. Number 3, IQ testing. Listen, your child's smart. I know they're smart. I don't need an IQ test to tell me that your child is smart. I know they're smart, but it is possible that your child could qualify for additional services through your state based on results of an IQ test. In the state of Iowa, if a child has a full scale IQ of less than 70, they qualify for waiver supports. Maybe you're in a spot where your child has struggled all throughout school, and not just by a little. It's not that Johnny doesn't get the high level nuances of calculus. It's that maybe they're more than a lap behind their peers, and you've done an amazing job. You went to tutors and you've worked on homework, and it's just been blood, sweat, and tears, and you have done the best you can. But as your child progresses through school gets harder. I consider myself to be generally intelligent, and I can't help my children anymore with their homework. It's too hard. I have to Google the Khan Academy and have some guy on the internet teach it to me. Kind of like what we're doing right now. Getting an IQ test, while maybe not the activity that you would most want for your child, can be very beneficial, particularly if they've been delayed and you've been putting this off. If they have a full scale IQ, below a certain threshold, they may be able to access additional services in the way of waiver supports, as in the state of Iowa. These services open up numerous doors for your children as they progress towards adulthood. Things like supported community living options and long-term access to Medicaid, irregardless of income. So please, if you haven't considered an IQ test, please consider getting this referral put in by your primary provider sooner rather than later, because these assessment wait lists can be 6 to 9 months long. It's also possible you may have to pay out of pocket. Maybe not, it just depends on your state. You may have to wait longer if you have to get your IQ testing done at a state facility like a university versus a private therapy group, which will likely only take cash or private insurance. But either way, get on this strategy quickly and start burning off the wait list. Number 4 in your New Year's resolution list is vocational rehab services. It's time to think about it. If your child's under the age of 12, skip to the next New Year's resolution. If your child is 12 or older, you have to consider vocational rehab services. What is this? Well, it can exist in the school, okay? There may be some individuals in the school who can help give your child access or experience with various providers in the community so that they can learn to work and provide value and receive value in the community, to earn a wage, to answer questions, to provide a service, and to be the fantastic people that they're created to be in your community. If your child would need a one-on-one work experience, those are harder to obtain. What I mean by that is, if your child is in a situation from a developmental standpoint where they would need somebody with them all the time walking through the steps, those are harder to line up, but not impossible. Don't give up on the idea that your child can transition from school into a vocational community. And the way to unlock those doors is to learn about vocational rehabilitation services in your school and in your state. Number 5, guardianship. As your child progresses towards the age of 18, once they cross that threshold, they become a legal adult. I know you know this, but what you might not know is when they're a legal adult, guardianship needs to be determined. And your attorney can help you set this up. Who handles their money? Who handles their taxes? Who helps make medical legal decisions? These are all things that can be discussed with an attorney as it relates to guardianship. Don't be surprised by this. As your child progresses through their teen years, you have to be asking the question, should we begin the process of filing for legal guardianship of our child so that we can ensure that the correct decisions are made that are in the best interest of this individual? Number 6, diagnostic clarification. Look, I'm only bringing this up to you because I've been doing this for 20 years. There are those among you who have been putting this whole thing off. You don't want to come see somebody like me. You don't want to know what the diagnosis is. You're not interested. You say, well, I don't think the diagnosis matters, and I know he's got some delays, but we're working through them and everything's going to be fine. I applaud that. I absolutely love that perspective. I believe that the most important thing in regards to children with special health care needs is not what they have, it's what we're going to do about what they have. So I'm on your team and I love this. But if you think your child could qualify for additional community services, if they could qualify for certain college programs that are dedicated to serve individuals with certain neurodevelopmental disorders, like autism as an example, then it's time to come and visit either a psychologist who has experienced the neurodevelopmental disorders or a developmental behavioral pediatrician. But it's time for diagnostic clarification. Or the last time you had a diagnostic clarification was 15 years ago. It might be time to revisit this because the diagnostic strategies may have changed. Things may fall off, things may be added. There are different therapeutic strategies that could be available in your community based on diagnostic nomenclature used. It's time to think about clarifying your child's diagnosis in 2024. Number 7, independence. What do you want to see for your child in their life? What do you think is an ideal situation for them as they transition into adulthood? Do you see them living independently? Do you see them living in a supported community with people who are coming in and out of the home to check on them as they live with peers or individuals with similar developmental skill sets? Do you see them living in your home and you taking care of them for the rest of their life directly? These are all hard decisions to make, but they need need to be discussed with your family. What do you see? Because when you determine what the end of the road looks like, what the goal looks like, and if I can convince you that the goal for your child is to live the most independent life possible, can they find a way to get to a work environment? Absolutely they can. Can they find a way to live an independent life to some extent? Yes, they can, but it's not going to happen by accident. As parents, as guardians, as family members, we have to choose this reality. We have to look into the future and choose the reality based on their skill sets, okay? We're not making up stories. We're not living in an imaginary world, but we're going to choose, based on their skill sets, a reality that reflects their strengths and abilities. We're not going to quit on a kid because they've got a neurodevelopmental disorder. They can do stuff, and they will do stuff. But sometimes we as parents and family members need to get out of their way. In a car, the windshield is big, the rear view is small, because we're supposed to spend most of our time looking forward. What do you see for your child's life? Don't spend your time looking back in 2024 to all the shouldas and the wouldas and the couldas. Nobody ends a sentence with, well, I guess we should have done this, and feels good about it. Nobody feels good about being should on. Don't do it to yourself. Spend your time looking forward into what your child can and will become in this life. But those are conversations that need to be had sooner rather than later, because once you've set in your sights the perceived future for your child, then it's time to get to work marching towards that goal. If you're wondering about IEPs versus 504s, how does it work from a federal level and how does it pertain to you, that's the next video.